Good morning and thank you for attending. Today I'm joined by Dr. Carol Zimbalati, Public Health Physician, to give an update on our local COVID-19 situation, and Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, will provide an update on our COVID-19 vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I'd also like to acknowledge the Métis historical presence in the region. I encourage everyone to continue on your journey of learning as we work to contribute to the process of reconciliation. On November 29, 2021, Dr. Kieran Moore announced the first two Omicron variants of COVID-19 in Canada. This announcement prompted more testing of specimens to be done in Ontario. And Omicron is spreading quickly. Reports have indicated case numbers can double every 2 to 4 days. So the question isn't if Omicron will take over from the Delta variant, but when. The Delta variant replaced Alpha in about 2 to 3 months. Projections indicate that Omicron could replace the Delta variant in as little as a few weeks. We'll have Omicron cases within our district and our case numbers will rise. As a community, we must do everything we can to slow its spread and reduce Omicron's impact. We were successful doing it before and we can do it again, but it'll take each and every one of us to do our part. No one wants to see more restrictions, and the best way to avoid that is to act now, all of us. There is still much to be learned about Omicron. However, what we do know is that continuing public health measures are our best defense. At this time, we do not know the protection level of the COVID-19 vaccines against Omicron. We do know there is still some protection, and that COVID-19 vaccines appear to still provide good protection against severe illness from the Omicron variant, and that most hospitalizations are in the unvaccinated. I continue to encourage everyone to be fully vaccinated against COVID-19. Follow public health measures, wear a face covering, physically distance, wash and or sanitize your hands often. Stay home if you have symptoms and arrange to be tested. Consider the risk when you plan to go out and observe gathering limits. Today, we have launched the indirect impacts of COVID-19 survey results. January and February 2021, the health unit surveyed individuals living in Nipissing and Parry Sound districts, age 16 and older, to learn about the indirect impacts of COVID-19 pandemic. Participants were asked about their experiences since the start of the COVID-19 pandemic. Survey questions were related to mental health and well-being, physical health, substance use, access to programs and services, child well-being, parental concerns, income, and access to basic needs. Some of the key findings include 3/4 of respondents reported feelings of loneliness or isolation more often since the start of the pandemic. 3/4 of respondents reported engaging in more recreational screen time, online gaming, while just over half reported difficulty sleeping more often and engaging in physical activity less often. 30% of respondents reported an increase in alcohol use, which is twice the rate of cannabis use increase and 3 times the rate of nicotine use increase since the start of the pandemic. There were also some encouraging findings from the survey, with respondents indicating that the pandemic had caused them to feel more thankful for things that they usually take for granted, spend more time in nature, and spend more time doing enjoyable activities. To review all the reports and key findings, please visit myhealthunit.ca/COVID impacts. And with that, I'll pass it over to Dr. Zimbalati.
Thank you, Dr. Chirico, and good morning, everyone. In the last 7 days, we had 29 new cases, bringing our total case count to 950, with 671 in the Nipissing district and 279 in the district of Parry Sound. The health unit currently has 35 active cases. Currently, there is 1 individual in hospital due to COVID-19. Since June 1st, 53% of individuals eligible for the vaccine who tested positive for COVID-19 were unvaccinated, and another 16% were partially vaccinated. 31% of cases have been identified as breakthrough cases, meaning individuals who have tested positive for COVID-19 were considered fully vaccinated. As cases continue to rise and the holiday season is here, I encourage everyone to consider the risk before attending a holiday gathering. Starting Monday, we will be updating the dashboard daily, Monday to Friday at 3 p.m. and will not be providing 2 updates on Monday as we have in the past. Now back to you, Dr. Chirico.
Thanks, Dr. Cimbalotti, and I'll pass over to Ms. Mantha.
Thanks. So good morning, everybody. As of yesterday at 3 p.m., 1,652 individuals in the 5 to 11 year age range had received their first dose of COVID-19 vaccine. This represents 19.5% of the 5 to 11 year olds in our district, compared to the province, who is sitting at 23.6% of 5 to 11s who have received their first dose. The 5 to 11 year old vaccine is now, and information about it is available on our COVID-19 status report. And further changes to the vaccine information on our public dashboard are coming soon, as we shift to include children 5 to 11 years old in our overall vaccination totals and percentages. For parents and guardians who are still unsure about vaccinating their child, just a reminder that there are several resources available online that provide credible information regarding vaccinations in children. And they offer advice on how to speak to your child and prepare them for their vaccine appointment. These resources include credible sources such as our website, the Ministry of Health site, Sick Kids, Immunize BC, as well as the University of Toronto. We have worked really hard to make our child and youth clinics a welcoming experience for those attending. And so we do this by making the spaces child and youth friendly, offering small toys, stickers, playing movies, and also some music. We have also chosen locations that are more kid friendly, such as our local schools and One Kids Place Children's Treatment Center with locations in North Bay and Parry Sound. If you would like to book your child into a child and youth clinic, you can book an appointment online, or you can call the health unit at 1-844-478-1400. We have several appointments available this weekend in North Bay at our child and youth clinic that is going to be located at the Northgate Square. We are in the former Gap clothing location at the mall, so please book an appointment and come and see us. On Monday, individuals 50 plus can start to book and receive their 3rd dose of COVID-19 vaccine. We highly encourage individuals who are eligible to receive their 3rd dose and to get it at a participating pharmacy or by booking into a local clinic. Now back to you, Dr. Chirico.
Thank you, Ms. Mantha. And so that ends our preamble. So we'll be able to take questions. You can put them in the left of your screen. Please associate your name with them. And I'll turn it over to Alex to read the first question, please.
Thank you, Dr. Chirico. Our first question comes from Sarah Bissonnette from the Parry Sound North Star. Why does it seem that positive cases, this question will go to Dr. Cimbalotti. Why does it seem that positive cases per number of tests is increasing? August 2021 had about the same number of cases to date this month, but August had about 6,000 tests done and December had about 1,000.
Yeah, so if I'm understanding your question correctly, it's about the percentage of tests that are positive. And we are seeing across the province that the percent positivity is rising. And that is likely, it just reflects that there is a higher prevalence of, there is a higher amount of circulating COVID-19 virus in the area. And so more people who are being tested are testing positive. I'm not sure if I adequately addressed your question, so if there's any clarifications you want to make, then please include it in the chat. And I was just wondering if Dr. Chirico had anything to say.
Yeah, I think that what's important is the percent positivity. And what we've seen is that Delta has lately been driving the number of increased cases throughout the province, as we've seen in our surrounding districts, how the cases have increased significantly. And percent positivity in those areas increase as cases increase. The province, at the beginning of November, we were looking at percent positivity is about 1.5 range, and then it doubled to over 3, and currently sitting at about 3.5 on average. We've been very fortunate in our district that our percent positivity has been less than 1. It's actually around, last one was around 0.6. So it is lower, and that is also obviously associated with, sort of lower case numbers. So we do know that this is likely to change, and that's the message that we want to get across, that this Omicron variant is a game changer. We need to pay really close attention to it and use really good judgment.
Thank you. Our next question is for you, Dr. Chirico. It comes from Eric Tashner from CTV News. With stricter measures coming in Sudbury's district, is the health unit still worried about people from Sudbury visiting North Bay and North Bayites visiting Sudbury?
Yes, thank you, Eric, very much for raising that. And that's an important question, an important point. And especially with, the holiday season coming, especially with more people being indoors. And then on top of it, you add the Omicron variant, which, as I am stressing, is significant. And we do not recommend people traveling. We do not recommend them going to other areas. People really need to do a risk assessment. Is it essential that you be there? Obviously, for medical reasons, for essential reasons, yes. But if it's non-essential, our recommendation currently is not to be traveling.
Thank you. Our next question is also for you, Dr. Chirico. It comes from PJ from the Nugget. With the increasing number of cases locally, are you looking to impose new restrictions over the holiday season?
We're, thanks for that, PJ. That's on everybody's mind, and we're seeing it all around us. We're seeing restrictions being put in place. I believe that if things start to really escalate within the province, I think there has to be a central response to this and central restrictions at the provincial level to be put in place, because we know, and we've experienced it in the past, when you have differences in different health unit regions with restrictions, people will travel to less restrictive areas. And it can be very, very complicated to address so many different factors and where the restrictions need to be. So yes, we are contemplating potential restrictions, and that's why I'm really asking people to act now, to have self-imposed restrictions. Simply, what's common and things that you're going to be doing on a daily basis, follow the public health measures and all the ones that I mentioned in the preamble. That if we can try to do those things now, it'll really lessen the chance that we have to impose restrictions. But that's going to be up to everybody. And again, what we're trying to do is keep the healthcare system intact, so that we don't have increased admissions to hospitals, so we don't have increased admissions to the ICU and deaths. And if the best way to do that is the public health restrictions that we don't want to have to put in place, but if we follow the restrictions that we have, and we also get people vaccinated, that will really have a big impact on whether or not we have to impose any restrictions.
Thank you. Our next question is for Ms. Mantha. It comes from PJ from the Nugget. With the increase, are you satisfied with the uptake of children 5 to 11 receiving their vaccine?
Yeah, thanks for that question. So we're definitely pleased to see so many 5 to 11-year-olds and their families coming out to our clinics and filling up those appointment spots. Are we satisfied? We'd like to see more. So I think our answer to this question, no matter what age group will be, we would like everybody who's eligible to be vaccinated. Getting children vaccinated will provide them with a strong level of protection against COVID-19 and its variants. And I think this is particularly important as we head into the holiday, like the winter break for children. And we want schools to be able to convene in the new year. We don't want to see lots of cases and outbreaks. So, you know, keeping schools open and being safer for in-person learning, it's key to have children, as many children as possible, vaccinated. So we're pleased with the turnout so far, but we'd like to see it increase. We have lots of appointments available throughout December, and we will continue to offer vaccine into the new year for anybody who would like one. As I mentioned earlier too, we do have appointments available this weekend at our child and youth clinic. So please book online or call our call center and make an appointment.
Thank you. Now, another question for yourself, Ms. Samantha, is from Sarah Bissonette from the Parry Sound North Star. Do you know how many 5 to 11-year-olds in the Parry Sound district have been vaccinated? And are you happy with this number? What are your thoughts?
Yeah, so the data that we have right now, or that I have with me today, is for the entire district of Nipissing and Parry Sound. And we will be reporting publicly on our dashboard the number of 5 to 11-year-olds in the district who are vaccinated. I'm not sure if we're going to break that down by Nipissing and Parry Sound. We might, but I'm not really sure yet. We're just in conversation about that. So I know that doesn't totally answer your question, but that's where we're at right now. We will be reporting on the overall number. I'm just not sure if we'll be doing Nipissing and Parry Sound districts separately. I don't know, Dr. Chirico or Dr. Zimbalati, if you have anything to add to that.
No, I'm not sure exactly where we're going to end up as far as reporting on that. We certainly are going to start reporting, as you said, about the 5 to 11-year-olds vaccinations, first and second doses on our website, but we'll have to look into the logistics. We can get back to you on that to determine if we have that information that we can easily send you, Sarah, if that's okay.
That's good, thank you. Our next question is for Dr. Chirico. It comes from Stu from Bay Today. What do you say to protesters of the vaccine clinics, especially those involving children?
Yeah, thank you for raising that, Stu. And it certainly was behavior that we will not tolerate. And we do recognize that people have the right to protest. However, they do not have the right to yell and scream and swear at children and intimidate and harass. And that's what that was. So it's absolutely inexcusable behavior. And I think positive thing that came out of that was that the rest of the population, the majority of people, found it to be equally offensive and unacceptable, and sent a clear message to them that that behavior is just not going to be tolerated. I think that they have the right to protest, but parents and families have the right to, and our staff have the right to do the work, provide essential, life-saving access to vaccines and in a safe manner, and not to be intimidated, and not to be harassed. So we have worked with police. We continue to work with the police, and we know that we will continue to have as many vaccines as are necessary to get these children and their families vaccinated, and we will not be intimidated by these people, and we will continue to do it and take every measure possible that we can within the law to ensure that that doesn't repeat.
Thank you. Now, our next question is also for you, Dr. Chirico, comes from Pauline. It is a follow-up around the restrictions. What type of restrictions would you be considering?
That's a very good question, Pauline. Pretty much everything is on the table as far as restrictions go to determine really what it is that we can do that's reasonable, that we can implement, that will help reduce the number of cases and keep our healthcare system from being overwhelmed, as well as individuals from having to suffer. So we would be looking at similar to what has occurred in other jurisdictions throughout Ontario, where you're looking at capacity limits, you're looking at businesses, you're looking at potential with school-aged children being vaccinated, depending on sports, and there's so many different things that we are considering. But we're looking at the evidence. We're seeing how things progress and evolve with the pandemic, and if there are certain areas or populations that would need to be targeted to help prevent more cases and spreading, that's what we're going to be looking at. But there is no magic formula. It is subjective, and we try to base our decisions really on the best evidence that's available at the time.
Thank you. Now our next question is for Ms. Mantha. This comes from Stu from Bay Today. Have there been any adverse effects due to the vaccine to the 5 to 11-year-old?
Sure, thanks for that question, Stu. So to my knowledge, we haven't received any reports of adverse effects. We've administered just over 1,600 pediatric vaccines to the 5 to 11-year-old group. And this is something we do track and monitor closely. To my knowledge, as of this morning, we have not received any reports of adverse effects. I know at clinics, the immunizers do talk to parents about, there might be a sore arm, or you might feel a little bit unwell after the vaccine or the day after. And so our immunizers counsel appropriately on that.
Thank you. So that is our last submitted question for the press conference. So that will conclude our press conference for today. Next press conference will be on December 23rd. Thank you.